Socialized healthcare in today's society. Across the globe domestically, the far-ranging debate over the quality and quantity of healthcare citizens deserve are largely determined by governmental healthcare policies crafted by the leaders in a country. While some countries lean towards the government's supplemented healthcare, such as universal and single-payer systems, others lean towards a capitalistic and free market ideology. The government's involvement in socialized healthcare is crucial on both a moral standard of obligation to its citizens, as well as empirically improving the quality of healthcare in the country. The primary job of a government, regardless of the root of its creation, ought to be to serve the people who it was created for. That means that government should have the moral obligation to assist its people along the basis of health. This means that in the case of healthcare policy, if it is directly seen as affecting the quality of life and ability to equally help the population, it should be a morally driven policy as well. Specifically, the same term of other basic necessities such as food and water require access to medical services as it is a necessity to individual freedom, opportunity, and self-responsibility as it is access to the protective services of fire or police departments. In addition, providing socialized healthcare falls under the umbrella of a government's duty to provide ideals such as privacy and dignity to the members of its nation. For example, in cases where socioeconomic disparities prevent certain individuals from being able to control their own bodies or have mental health autonomy, it is the fault of the government for not ensuring its citizens are able to be safe. This is why certain international groups, such as the World Health Organization and the United Nations, have deemed it so that healthcare is known and decreed as a universal right. In fact, the government's actions go hand in hand with that of the free market because private innovation and government intervention represent not opposing forces, but rather partners in a common enterprise. This shows how the government socializing healthcare still goes hand in hand with the private sectors and in actions of the people, demonstrating how socialized healthcare does not equate to control, but rather increasing accessibility and availability. As most developed countries across the globe prioritize the system, the precedent of democracies spanning globally shows that the general consensus is that healthcare is a right the government provides. A government thus has the primary obligation to uphold its citizens' livelihoods, and as lives are lost due to modern era issues such as high drug prices, lack of insurance, and a small scope of means-tested welfare for healthcare, it proves that there should be a moral obligation towards healthcare. Outside of obligation, a socialized healthcare system has the proven track record in order to create a more stable, successful healthcare system that can be mutually beneficial for all parties involved. The primary example would be looking to the comparison between domestic healthcare results in America as compared to the developed countries who use universal healthcare. Data shows how America's healthcare system has a higher disease burden, more hospital admissions, and more medical errors than that of comparable countries across the globe. Zooming out, the data further discusses how America has the most expensive healthcare system in the world and is ranked last in healthcare rankings in comparison to 11 developed countries with socialized healthcare. The data finalizes in citing rankings from the World Health Organization, which previously ranked France, a country with a socialized healthcare system, as the best in the world, while the United States was reported to be more than 30 spots down. The common trend that is shown is clear. There is a large gap between the accessibility and equity in developed countries who implement a socialized healthcare system and countries which continue to have for-profit healthcare systems such as the United States. A form in which a healthcare policy does this by making sure that there is no financial burden for individuals who seek to purchase medicine or treatments, as well as ensuring reductions in massive administrative costs that streamline the process of healthcare. By driving down the costs and ensuring that there are no gaps in coverage for those who need it the most, a country with socialized healthcare could see better health outcomes and lives saved, which is a convincing reason for a change in operations. In direct contrast to those who argue that socialized healthcare would be beneficial to the health of citizens, there are many who note that the universal healthcare model is fundamentally imperfect. For example, it was noted that in Canada, there are weeks of delays for certain surgeries, while in the United Kingdom, there are many drugs that fall far behind research and development due to lower profits for companies. These issues of delays are projected to be compounded in the population dense and busy countries such as America, where it would have to process more than 1 billion physicians visits, 40 million hospitalizations, and 3.7 billion prescriptions each year. Another example is how delays may exist to a small extent in certain countries, but when looking to for profit systems, over half of Americans experience longer delays than countries with universal healthcare. In direct contrast, all industrialized nations see doctors faster than Americans do, as well as seeing decreasing to almost no delays in countries such as Germany and Sweden. Thus, while minor delays may occur, the comparative always seems to favor a socialized system because the outcomes would only get better as compared to the dismal situation they are stuck in as of now. Even when prices are low, there is always an incentive to provide quality healthcare because of the risk of failure, which is why positive outcomes still exist in socialized healthcare systems. When examining the health outcomes in general, the fact that in every case of socialized healthcare, the countries are ranked higher and save more lives than for-profit systems indicate how the current trend of healthcare supports that of driven down prices. While there are always some adverse implications to implementing drastic changes in policy, the benefits of saving lives seem to far outweigh the harms of private corporations losing marginal revenue. When examining the policy of socialized healthcare, many are discouraged by the current narrative that is spun about government intervention and bureaucracy. However, by examining the current results of universal healthcare systems as compared to domestic policy that costs thousands of lives a year, the conclusion becomes much more straightforward that the government has both a moral obligation to provide healthcare as well as a reason based on the better outcomes this system brings to its citizens. As countries increasingly continue to adopt the system of socialized healthcare across the world to represent oneself as a developing or developed nation, major players such as the United States should take the same step to signal their care for health outcomes over profit-driven incentives. In the middle of a health crisis where individuals lack equity, accessibility, and quality in their healthcare system, socialized policy is a step in the right direction to preserve the economics of the country while ensuring that people have safer and more dignified lives on a moral level. Although socialized policies seem like a leap of faith away from the free market ideology, it preserves many of the core principles that are created at the root of the country, while cementing the most important aspect of what is to be a government, ensuring a better quality of life for the people in a country.